discussion, we find two types of this. The first one is gigantism. Gigantism, also called pediatric acromegaly pituitary gigantism, is a rare condition that happens when a child or adolescent have high level of growth hormone (GH) in their body, which is cause them to grow very tall. The second one is dwarfism. Dwarfism is short stature that results from a genetic or medical condition. Dwarfism is generally defined as an adult height of 4 feet 10 inches, which is 147 centimeters or less. The average adult height among people with dwarfism is 4 feet. In very small and very large, as opposed medium height come with own set of advantages and disadvantages. Keep in mind that perception of height can be very greatly between cultures and society. So what is considered small or large can be different. Here we are some general advantages and disadvantages. Advantages of being small, the first one is style and discretion. Smaller individuals can often move more discreetly and go unnoticed, which can be advantageous for certain situations. The second one is energy efficiency. Smaller individuals generally require fewer calories to function, which can be advantageous in resource-scarce environments. The third is comfort in tight space. Smaller individuals may find it more comfortable fit into tight or cramped space, which can be useful in various scenarios. Longevity. For the fourth is longevity. Some studies suggest that smaller individuals may have a longer lifespan on average, possibly due to reduced wear and tear on their body. And there is advantages for being very large. The first one is physical strength. Large individuals may often have more muscle mass and physical strength, which can be advantageous in physically demanding tasks or sport. Fourth, two is leadership perception. In some cultures, taller individuals are received as more authority and are often chosen for leadership roles. And the last one is greater reach. Taller individuals can easily reach high places and may have an advantage in sports like basketball, netball, and for disadvantages, being very large is health risk. Very large individuals are at higher risk for certain health issues such as heart disease, joint problem, and diabetes. The second is resource intensity. Large individuals physically require more calories and research to maintain, which can be a disadvantageous in research-scarce environment. The third is social challenge. For being extremely tall or large can make it difficult to fit into standard size furniture, vehicle, and space, leading to discomfort and inconvenience. Disadvantages for being very small. For the first one is limited reach. Similar stature may limit one's ability to reach high shelf or perform tasks that require physical reach or height. For two is vulnerability. Smaller individuals can be perceived as more vulnerable and may be targeted by aggressors or bullies. And the last one is health concern. Some health issues such as obesity and related conditions may be less common in similar individuals, but they can still have unique health challenge.
For the factors of gigantism, we have two factors here. The first one is excess growth hormone. Many cases of gigantism result from primary GH secretion by pituitary tumors comprised of somatotropes, GH secreting cells, or mammosomatotrophs, which is GH and PRL secreting cells, either in the form of a pituitary microadenoma or rarely macroadenoma. The relative contributions of inherent pituitary defects versus hypothalamic factors in the pathogenesis of pituitary tumors are far from resolved, however. The monoclonal nature of most pituitary adenomas, confirmed by inactivation studies, has implied that they originate from a single altered cell. The concept of an intrinsic pituitary defect is further supported by the discovery that specific molecular genetic abnormalities stem from the basis of GH hypersecretion in many cases. The second factors are genetic mutations. Genetic mutations are infrequent but have the potential to cause conditions characterized by either excessive production of growth hormone or heightened responsiveness to growth hormone. Although these instances are rare, they can play a role in the development of gigantism. For the factor of dwarfism, we have three factors, which is achondroplasia, Turner syndrome, and hypothyroidism. The first one is achondroplasia. Though achondroplasia is a genetic condition, 4 out of 5 people who have it also have 2 parents who are average size. If you have achondroplasia, you have one mutated gene associated with the condition and one unaffected version of that gene. This is the most common cause of dwarfism. The second one is Turner syndrome. Did you know that this condition affects only females? Instead of inheriting 2 fully functioning X chromosomes from your parents, you inherit 1 X chromosome and are missing a second, or at least a part of a second X chromosome. Males, by comparison, have an X chromosome and a Y chromosome. Last but not least, we have hypothyroidism. An underactive thyroid, especially if it develops at a young age, can lead to many health problems, including limited growth. Other complications include low energy, cognitive problems, and puffy facial features. A newborn's thyroid health should be checked as a matter of routine screenings.
I would like to present symptom of gigantism. Firstly, symptom of gigantism is unusual features which has very prominent forehead and prominent jaw. They also have large hands, feet with thick fingers and toes. Secondly, we can detect from enlargement of internal organs or visceromegaly such as liver, spleen, stomach, kidney or pancreas. Because of what function, the spleen may be affected by many conditions involve blood. Lastly, excessive sweating is hyperhidrosis. It causes body to sweat more than it needs to, sometimes for no apparent reason. This condition may make you feel uncomfortable or embarrassed, but it is common actually. Healthcare provider can help you to find treatment. Symptom of dwarfism is short stature due to abnormal bone growth which has bow leg, basal nasal bristle, with bony area at the top of the nose, prominent forehead, short finger, toes, and has white hands and feet. Next, we have hydrocephalus, which a build-up of fluid around the brain. This excess fluid causes your ventricle to widen iodine, which puts harmful stresses on the tissue of your brain. There is no cure for hydrocephalus, but can be treated. Also, symptom of dwarfism can causes from ear infection when a bacteria or virus infects the space behind your child eardrum. I would like to present about is gigantism genetic. Any children with gigantism has a genetic mutation. Actually, gigantism is very rare disorder that causes from pituitary tumor to form. It is a very serious condition that is nearly always caused by an adenoma and may run in some families due to a genetic mutation. In conclusion, sometimes gigantism runs in families, but most of the time it is not inherited. Is dwarfism genetic? Yes, most of dwarfism is related condition to genetic disorder and result change from a DNA percent. In most cases, genetic mutation happens randomly and is not passed from a short-statured parent to a child. This means that most parents who have children diagnosed with dwarfism are of average height. To conclude, rating that the child will inherit the condition increase if one or both parents have a dwarfism diagnosis.
After that, we have a treatment for gigantism. The first one, we have surgery. The surgery is for us to remove or reduce the size of the pituitary tumor. Since the pituitary tumors that cause gigantism are often large, children with gigantism may need multiple surgeries to remove the tumor and effectively regulate GH levels. Other than that, we have radiation therapy. It can help lower growth hormone levels when surgery isn't effective in doing so. Radiation therapy uses specialized equipment to target the tumor with radiation beams. Lastly, if you don't want to do the surgery or radiation therapy, maybe taking a medication will help. Bromocriptine and cabergoline are drugs that can be used to lower growth hormone levels. These are typically given in pill form. They may be used with octreotide. Octreotide is a synthetic hormone that, when injected, can also lower the levels of growth hormone and IGF-1. Next is the treatment for dwarfism. Firstly, we have hormone therapy. The treatment includes daily injections when a child is young, though injections may continue into a person's 20s. This may be done if there are concerns about full adult maturation and sufficient muscle and fat. Secondly, we have surgical options. Surgical treatments include those that can help to correct the direction of bone growth, stabilize the spine, increase the channel in the vertebrae surrounding the spinal cord, to relieve pressure on the spinal cord. Lastly, we have physical therapy and orthotics. Physical therapy is often prescribed after limb or back surgery to help you regain or improve your range of motion and strength. Physical therapy may also be advised if dwarfism is affecting the way you walk or is causing you pain that doesn't require surgery.
Dwarfism live more longer because they can reduce risk of cancer. Studies have shown that individuals with dwarfism have a lower risk of developing certain types of cancer, such as breast and prostate cancer. This may be due to the presence of certain genetic factors to help they protect against cancer. Number 2 is because of the lower incidence of heart disease. People with dwarfism often have lower level of cholesterol and blood pressure, which can reduce their risk of developing heart disease and other cardiovascular conditions. Third is because lower metabolic rate. Individuals with dwarfism typically have a slower metabolic rate, which can contribute to a longer lifespan. Number 4, it changes the immune system. Some research suggests that people with dwarfism may have a more robust immune system, which can help protect them from infection and other healthy issues. And the last is genetic factor. Some genetic factors associate that dwarfism may also contribute a longer lifespan. For example, certain gene mutation that cause dwarfism have been linked to increased longevity of animals that because of their cardiovascular strain. The heart of giant individual has to work much harder to pump blood throughout the body, which can lead to cardiovascular problem and increase risk of heart failure at young age. Second is because organ failure. The organ of a giant person may struggle to keep up with the demand of their large body, leading to organ failure and high risk of premature death. Third, because of the skeletal issue, gigantism can put a significant amount of strain of the skeletal system, leading to joint problem, arthritis, and increased risk of fracture, which can contribute to a shorter lifespan. Number 4, hormonal imbalance. Gigantism is often caused by an overproduction of growth hormone, which can lead to hormonal imbalance and health issues that can reduce life expectancy. At last is because increased susceptibility to disease. A giant individual may be more susceptible to certain disease and healthy conditions due to their large size, which can contribute